If you're over 50 and you've been feeling more tired than usual, maybe experiencing some unusual aches in your chest, jaw, or shoulders that you've been dismissing as just part of getting older, please stay with me for the next few minutes. Your body might be trying to tell you something important. And today, I'm going to share 10 early warning signs that many of us ignore, but that could signal heart trouble developing. We'll go through each one slowly and carefully, and I'll help you understand what's normal aging versus what deserves a conversation with your doctor. I promise to keep everything simple and practical, with no scary medical jargon, just helpful information you can actually use. Hello, my friend, and welcome back. I'm Dr. Sarah Truman, and I'm so glad you're here with me today. Now, before we go any further, I want to be completely clear about something important. I'm a health coach and wellness educator. I'm not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before starting any new exercise, changing your diet, or trying any supplement, especially if you have any health conditions or take medications. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. Today, we're talking about something that affects millions of us as we age, our heart health, and specifically those subtle signs our body sends us when our heart might need some extra attention. The reason this matters so much for those of us over 50 is that heart disease remains the leading cause of health problems in our age group. But here's the encouraging news. When we catch these signs early and take action, we often have the power to make meaningful changes that support our heart health. Here's what we'll cover today. First, I'll explain why our hearts change as we age and why that makes us more vulnerable to certain problems. Then we'll go through 10 specific warning signs that many people ignore, thinking they're just normal aging. I'll share what each one might mean and when it's time to pick up the phone and call your doctor. We'll also talk about some gentle lifestyle habits that research suggests may help support heart health. And finally, I'll be very clear about the red flags that mean you need immediate medical attention, not tomorrow, not next week, but right now. As we age, our hearts go through natural changes, and understanding these changes helps us make sense of the symptoms we might experience. Think of your heart like a faithful pump that's been working nonstop for 5, 6, 7 decades or more. Just like any hardworking machine, it starts to show some wear. The walls of your heart might become a bit thicker and stiffer. Your arteries, those highways that carry blood throughout your body, they can become less flexible. Kind of like how a garden hose gets stiffer after many years in the sun. These changes happen to almost everyone to some degree, and they're part of normal aging. But here's where it gets tricky. Sometimes these normal changes can make us more vulnerable to heart problems, and sometimes what we dismiss as normal aging is actually our heart asking for help. The challenge is knowing the difference. Many of us grew up in an era where we were taught to tough things out, to not complain, to just keep going. And while that resilience has served us well in many ways, when it comes to our hearts, paying attention to subtle changes can make all the difference. The good news, and I really want you to hear this, is that your heart is incredibly resilient. Even at 50, 60, 70, or beyond, your heart can respond positively to healthy changes. Small improvements in how we move, what we eat, how we manage stress, these can all support heart health. You're not too old to make a difference. In fact, some research suggests that people who make healthy lifestyle changes after 50 can see significant improvements in their heart health markers. Now, let's dive into our first warning sign, and this one might surprise you. It's unusual fatigue or exhaustion that doesn't match your activity level. I'm not talking about feeling tired after gardening all afternoon or playing with the grandkids. I'm talking about feeling worn out from activities that used to be easy for you. Maybe walking to the mailbox leaves you needing to sit down. Maybe you're too tired to cook dinner even though you haven't done much all day. This kind of fatigue can be one of the earliest signs that your heart is working harder than it should. Here's what might be happening in simple terms. When your heart isn't pumping as efficiently as it should, your body doesn't get all the oxygen and nutrients it needs. It's like trying to water your whole garden with a kinked hose. Some areas get enough water, but others don't, and the whole system has to work harder to compensate. Your body's response is to make you feel tired so you'll rest and demand less from your heart. Now, fatigue can have many causes. It could be your thyroid, your sleep quality, depression, medications, or dozens of other things. But if you've noticed that your energy has dropped significantly over the past few weeks or months, and especially if it's combined with any other signs we'll discuss today, it's worth mentioning to your doctor. They can run simple tests to check if your heart is involved. Here's something practical you can do starting today. Keep a simple energy diary for a week. Each day, rate your energy on a scale of 1 to 10 when you wake up, at noon, and before bed. Note what activities made you especially tired. This information can be incredibly helpful for your doctor. And remember, even if your fatigue isn't heart-related, it's affecting your quality of life and deserves attention. You don't have to accept exhaustion as just part of getting older. Our second warning sign is shortness of breath during activities that didn't previously wind you. Again, I want to be clear about what we're looking for here. It's normal to breathe harder when you climb stairs or walk uphill, but if you're getting winded doing things that were easy 6 months ago, like making the bed, carrying groceries, or even having a conversation, that's worth paying attention to. Let me explain what might be happening. Your heart and lungs work together like dance partners. When your heart struggles to pump blood efficiently, fluid can back up into your lungs, making breathing feel more difficult. It's not that your lungs are failing, they're just dealing with extra fluid that shouldn't be there. Some people describe it as feeling like they're breathing through a wet cloth or trying to catch their breath in humid weather. Here's a simple test you can try, but please do this safely. Sit comfortably in a chair for 5 minutes, just relaxing. Then stand up and walk at your normal pace for 2 minutes, maybe down your hallway and back. If you need to stop and catch your breath, or if you're breathing much harder than you think you should be, make a note of it. This doesn't mean you definitely have a heart problem, but it's information worth sharing with your doctor. If you do experience shortness of breath, here's a technique that might help in the moment. Sit down in a chair with your feet flat on the floor, lean slightly forward, resting your elbows on your knees. This position can make breathing feel easier. Breathe in slowly through your nose for a count of 4, then out through pursed lips for a count of 6. This won't fix an underlying heart problem, but it can help you feel more comfortable while you're waiting to see your doctor. And please, if you experience sudden, severe shortness of breath, especially if it's accompanied by chest pain or dizziness, don't wait. Call 911 or have someone drive you to the emergency room immediately. This is one of those situations where it's always better to be safe than sorry. Let's move to our third warning sign, which is swelling in your feet, ankles, or legs. Now, many of us deal with some ankle swelling, especially if we've been on our feet all day or if it's hot outside, but the swelling we're concerned about is different. It tends to get worse as the day goes on, and when you press on it with your finger, it leaves a dent that takes a few seconds to bounce back. We call this pitting edema, but you don't need to remember the medical term. What's happening here is that when your heart isn't pumping strongly enough, fluid can accumulate in the lowest parts of your body, which are usually your feet and ankles. Gravity pulls the fluid down, and your heart doesn't have enough oomph to pump it back up efficiently. Think of it like a sump pump in a basement that's not quite keeping up with the water coming in. The water, or in this case, fluid, starts to accumulate. Here's how to check for concerning swelling. Look at your ankles at the end of the day. Are they noticeably puffier than they were this morning? Press gently but firmly on your shin bone about 3 inches above your ankle. Hold for 5 seconds, then release. If you see an indentation that slowly fills back in, that's the kind of swelling we're talking about. Also, pay attention to whether your shoes feel tighter at the end of the day or if you see sock marks that are deeper than usual. If you do have swelling, here are some things that might help while you're waiting to see your doctor. When you're sitting, prop your feet up so they're level with your heart or slightly higher. If you're watching TV, put a couple of pillows under your calves. When you sleep, you can put a folded blanket under the foot of your mattress to elevate your legs slightly. Also, try to avoid sitting or standing in one position for too long. Even just flexing and pointing your feet while sitting can help circulation. But remember, leg swelling can have many causes, including medications, vein problems, or kidney issues. The important thing is not to ignore it. especially if it's new or getting worse. And if you have swelling along with shortness of breath or chest discomfort, please seek medical attention promptly. The fourth warning sign we need to discuss is irregular heartbeat or palpitations. Now, everyone's heart skips a beat occasionally, and that's usually nothing to worry about. But if you're feeling like your heart is racing, fluttering, or doing flip-flops in your chest regularly, especially if these episodes last more than a few seconds, it's worth investigating. Let me help you understand what you might be feeling. Some people describe palpitations as feeling like their heart is pounding so hard it might jump out of their chest. Others say it feels like their heart pauses and then gives a big thump to catch up. You might feel it in your chest, throat, or neck. Sometimes it happens at rest, sometimes during activity, and sometimes it wakes you up at night. Here's something important to know. Caffeine, stress, dehydration, and certain medications can all cause palpitations. So can hormonal changes, which is why many women experience them during menopause. But palpitations can also signal an irregular heart rhythm that needs treatment. The tricky part is that serious rhythm problems don't always feel dramatic. Sometimes the most dangerous rhythms cause subtle symptoms or no symptoms at all. If you're experiencing palpitations, try this simple technique to gather information for your doctor. When you feel your heart acting up, if it's safe to do so, stop what you're doing and find your pulse. You can feel it on your wrist below your thumb or on your neck beside your windpipe. Count the beats for 30 seconds and multiply by 2. Also note whether the rhythm feels regular like a steady drum beat or irregular like a jazz drummer improvising. Write down the time, what you were doing, how long it lasted, and any other symptoms you had. There are also some things you can try that might help calm palpitations, though these aren't cures, just comfort measures. Try coughing forcefully a few times. Try the Valsalva maneuver, which means bearing down like you're having a bowel movement. Try splashing cold water on your face. These actions can sometimes reset your heart's rhythm, but if palpitations are accompanied by chest pain, severe shortness of breath, or fainting, please call 911 immediately. Our fifth warning sign is persistent chest discomfort or pressure. Now, we all know that chest pain can signal a heart attack, but what many people don't realize is that heart-related chest discomfort doesn't always feel like the dramatic, crushing pain we see in movies. In fact, especially for women and people with diabetes, heart problems can cause subtle chest symptoms that are easy to dismiss. The discomfort might feel like pressure, squeezing, fullness, or even just an uncomfortable awareness in your chest. Some people describe it as feeling like an elephant sitting on their chest, while others say it's more like a band tightening around their ribcage. It might come and go, lasting a few minutes at a time. It might get worse with physical activity or stress and better with rest. Or it might seem random, with no clear pattern. Here's something really important. Heart-related chest discomfort doesn't always stay in your chest. It can radiate to your shoulders, arms, especially the left arm, your back between your shoulder blades, your neck, jaw, or even your teeth. Some people have told me they went to the dentist thinking they had a tooth problem only to find out later it was their heart. Now, chest discomfort can have many non-heart causes. Acid reflux, pulled muscles, anxiety, lung problems, and even gas can cause chest pain. But here's my rule of thumb, and I want you to remember this. Any new, unexplained chest discomfort deserves medical attention. Your doctor would much rather see you and find out it's just heartburn than have you ignore something serious. If you experience chest discomfort, make note of exactly where you feel it, what it feels like, how long it lasts, what makes it better or worse, and any other symptoms you have at the same time. This information is gold for your doctor. And please, if you have chest discomfort along with shortness of breath, nausea, sweating, or a feeling of impending doom, don't drive yourself to the hospital. Call 911. Time matters when it comes to heart problems. The sixth warning sign is unusual sweating or breaking out in a cold sweat for no clear reason. I'm not talking about normal sweating from hot weather, exercise, or hot flashes. I'm talking about suddenly feeling clammy or breaking into a sweat while you're sitting still in a comfortable room. This kind of sweating, especially when combined with other symptoms, can signal that your heart is under stress. What happens is that when your heart struggles, your body goes into a mild fight or flight response. Your nervous system releases stress hormones that can trigger sweating. It's your body's way of trying to cool you down and prepare you for action, even though you're not actually doing anything strenuous. Some people describe it as the kind of sweat you might get when you're nervous about public speaking, except it happens for no apparent reason. Pay attention to when this sweating occurs. Does it happen at night, soaking your sheets even though your room isn't hot? Does it come on suddenly during the day along with feeling unwell? Women especially should pay attention to this symptom, as unusual sweating can be one of the more common heart attack signs in women, even without chest pain. If you're experiencing unusual sweating, keep track of when it happens, what you were doing, and what other symptoms you had. Also note things like whether you'd just eaten, what medications you'd taken, and your stress level. All of this helps your doctor piece together what might be happening. In the meantime, keep yourself comfortable. Have a small towel handy, wear layers you can easily remove, stay hydrated by sipping water throughout the day, and if the sweating comes with chest discomfort, nausea, or feeling faint, please seek immediate medical attention. Our seventh warning sign is jaw, neck, or upper back pain that seems to come from nowhere. This one surprises many people because we don't usually associate these areas with our hearts. But remember, your heart shares nerve pathways with other parts of your upper body. When your heart is in distress, the pain signals can get confused and show up in unexpected places. The pain might feel like a toothache in your lower jaw. It might feel like a muscle strain in your neck. It might feel like someone is pressing between your shoulder blades. What makes this tricky is that the pain might come and go, and it might not seem related to physical activity. You might notice it more when you're stressed or after eating a heavy meal. I've talked to people who spent months going to dentists, chiropractors, and massage therapists for jaw and neck pain only to find out later it was their heart all along. This doesn't mean every jaw ache is heart-related, of course. But if you have unexplained pain in these areas, especially if it comes with any other symptoms we're discussing today, it's worth mentioning to your doctor. Here's a simple way to think about it. If you have pain in your jaw, neck, or upper back and you can't explain it with a clear cause like sleeping wrong, lifting something heavy, or grinding your teeth, make a note of it. Track when it happens, how long it lasts, and what makes it better or worse. If rest relieves it but activity brings it back, that's especially important information. The eighth warning sign is nausea or stomach upset that isn't related to something you ate. Some people experience heart problems as stomach symptoms rather than chest symptoms. You might feel queasy, like you're getting the flu. You might have indigestion that antacids don't help. You might even vomit. This happens because your heart and digestive system share nerve pathways and distress signals can get crossed. This symptom is especially common in women and people with diabetes. In fact, some people have what we call silent heart attacks, where stomach upset is the main symptom. They think they have food poisoning or a stomach bug and only find out later through testing that they had a heart event. Of course, nausea has countless causes that have nothing to do with your heart. But if you're experiencing unexplained nausea along with unusual fatigue, sweating, or any chest, jaw, or arm discomfort, please don't ignore it. It's better to get checked and find out it's nothing serious than to miss something important. If you're dealing with nausea that might be heart-related, try sitting upright rather than lying flat. Take slow, deep breaths through your nose. Sip cool water or suck on ice chips. But if the nausea is severe or comes with other concerning symptoms, please seek medical attention promptly. Our ninth warning sign is dizziness or feeling lightheaded, especially when standing up or during mild activity. Now, many of us get a little dizzy if we stand up too fast, especially as we get older. That's often just a normal blood pressure adjustment, but if you're getting dizzy regularly or if the room spins when you're just walking around your house, your heart might not be pumping blood to your brain as efficiently as it should. Think of your cardiovascular system like the plumbing in a two-story house. Your heart is the pump that needs to push blood all the way up to your brain against gravity. If the pump isn't working well, the upstairs doesn't get enough water pressure, or in this case, blood flow. Your brain notices this immediately and makes you feel dizzy as a warning sign. Dizziness can also happen if your heart is beating too fast, too slow, or irregularly. Each of these rhythm problems affects how well your heart pumps blood. It's like a washing machine that's off balance. It's still spinning, but not efficiently, and things aren't getting clean properly. If you're experiencing dizziness, here's what you can do for safety. When you feel dizzy, sit or lie down immediately. Don't try to tough it out. When getting up from lying down, first sit on the edge of the bed for a minute before standing. When you do stand, have something sturdy to hold on to. Keep your home well lit so you can see clearly if you feel unsteady. And please, if you feel dizzy, don't drive until you've talked to your doctor and figured out what's going on. The 10th and final warning sign is unusual weakness, particularly if it comes on suddenly or affects one side of your body more than the other. I'm not talking about the normal muscle fatigue you feel after exercise or the general weakness that comes with having the flu. I'm talking about unexpected weakness that makes everyday tasks difficult. Maybe your arms feel too heavy to lift. Maybe your legs feel like jelly when you try to stand. Maybe you drop things because your grip isn't as strong as usual. This weakness happens because your muscles aren't getting enough oxygen-rich blood to work properly. It's like trying to run a power tool with a dying battery. It might work a little, but not like it should. Now here's something critical. Sudden weakness, especially on one side of your body, can also be a sign of stroke, which is related to but different from heart problems. If you suddenly can't lift one arm, if one side of your face droops, or if your speech becomes slurred, call 911 immediately. Don't wait to see if it gets better. Time is brain when it comes to stroke. For more gradual weakness that might be heart-related, keep track of when you feel weakest. Is it worse in the morning or evening? Does it improve with rest? Can you predict when it will happen? This information helps your doctor understand whether your heart might be involved or if something else is going on. Now let's talk about some common mistakes and myths about heart health that I hear all the time. First, many people believe that if they don't have chest pain, they can't be having heart problems. But as we've discussed today, heart issues can show up in many ways, and chest pain might not even be the main symptom. Your jaw, your stomach, your energy level, these can all be telling you about your heart. Another myth is that heart problems always happen suddenly and dramatically. While heart attacks can certainly be sudden, many heart problems develop slowly over months or years, giving subtle warning signs along the way. That's why paying attention to gradual changes in how you feel is so important. Some people also think that if they're taking heart medication or have had a heart procedure, they don't need to worry about symptoms anymore. But medications and procedures don't cure heart disease, they manage it. You still need to pay attention to your body and report new or changing symptoms to your doctor. I also hear people say they don't want to bother their doctor with vague symptoms or false alarms. Please hear me when I say this. Your doctor would much rather see you 10 times for nothing than miss the one time it's something serious. You're not being a hypochondriac by paying attention to your body and seeking help when something doesn't feel right. Now I need to be very clear about when you should seek immediate medical attention. Please call 911 or go to the emergency room right away if you experience chest pain or pressure that lasts more than a few minutes or goes away and comes back. Pain or discomfort in one or both arms, your back, neck, jaw, or stomach, shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea or lightheadedness, sudden weakness or numbness in your face, arm, or leg, especially on one side, sudden confusion or trouble speaking, sudden trouble seeing in one or both eyes, sudden severe headache with no known cause, or any combination of these symptoms. Even if you're not sure it's serious, if something feels really wrong, please get help. Don't worry about being embarrassed if it turns out to be nothing. Medical professionals would always rather you come in and be safe. And never drive yourself to the hospital if you think you might be having a heart problem. Call 911 so you can get help on the way. Let's quickly recap what we covered today. We talked about 10 warning signs your heart might need attention. Unusual fatigue that doesn't match your activity level. Shortness of breath during previously easy activities, swelling in your feet, ankles, or legs, irregular heartbeat or palpitations, chest discomfort or pressure, unusual sweating or cold sweats, jaw, neck, or upper back pain, nausea or stomach upset, dizziness or lightheadedness, and unusual weakness. Remember, you don't have to do everything at once. Start by simply paying more attention to how you feel each day. Maybe keep a simple health diary where you note any unusual symptoms. If you notice any of the warning signs we discussed, especially if you have more than one or they're getting worse, please talk to your doctor. You know your body better than anyone. If something doesn't feel right, trust your instincts. Small steps really do add up over time. Even simple changes like taking a daily walk, eating more vegetables, managing stress better, and getting good sleep can support your heart health. Be patient and kind with yourself. Progress looks different for everyone, and what matters is that you're paying attention and taking action when needed. If you found this helpful, I'd be so grateful if you'd give this video a thumbs up. It helps other seniors find this information too. Your support means the world to me and helps me know what topics you want to hear more about. And if you're not subscribed yet, consider joining our community. I share new videos every week to help you stay strong, healthy, and independent as you age. We talk about everything from balance exercises to nutrition tips to managing common health concerns. It's a warm, supportive community of people who understand that aging doesn't mean giving up on feeling good. If you'd like to keep going, I recommend watching my video on 5 daily habits for a stronger heart after 50. I'll put the link on screen and in the description. It's full of simple, practical tips you can start using today to support your heart health. Thank you so much for spending this time with me today. Remember, you're not alone in this journey. We're all figuring out how to age well together, and every small step you take toward better health matters. Take care of yourself, listen to your body, and don't hesitate to seek help when you need it. I'll see you in the next video.